Hey, Katie, tell me about paid leave for us, paid leave for the U.S.
Hello, it's nice to meet you. I wish that we were meeting in person. We are a national campaign to win federal paid family and medical leave policy. So think of us as like a tipping point campaign, really trying to push the issue over to a win. And our members are people who are passionate about winning paid family leave. We're all over the country. And you'll meet several of our advocates today, along with advocates from 0 to 3 and some prominent business leaders in the community.
Do you say it PL+US or PL+US?
Just plus.
Just say plus.
Mm-hmm.
Okay. Ms. McGhee, you're in Columbus, right? You're an activist in Columbus? Ms. McGhee?
Yes, I am. Nice to meet you.
And tell me about your children. You have children, I assume?
I do. I have two. I have an 11-year-old and a 3-year-old.
11-year-old and a 3-year-old. Is the 11-year-old to help you take care of the 3-year-old?
Yes.
That's pretty cool.
And you're also active with the Moms to Be program, which
Yes.
which I think you might know about, Senator.
I do.
Yeah.
Council member.
Thank you, Liz.
Yeah. It's a really great program in Columbus. Thank you for what you do.
Cool.
Thank you.
Okay, I think
Bob,
we'll
tell
get
me about what you're doing.
Is that for me?
Yeah, Bob.
I am owner of Wolf's Ridge Brewing along with my dad. So I think similar family business dynamic with you and Liz in downtown Columbus, and just a advocate for paid leave and a policy that we've kind of put together over the past 7 years.
Good for you. And how you guys doing now with everything?
It's definitely tough. The PPP helped us a bit. Obviously, it was a little ill-timed with just everything that was going on in Ohio for us specifically. But we are. It's hard, not going to lie. Bars and restaurants are doing pretty tough right now. The wholesale side of the business is doing okay, but a lot of our clients there, customers on the wholesale side are definitely they're limping along. So it's tough there.
Okay, folks, I think we're ready to get started. So excited to hear.
Any moment now. So, all right.
Yeah, excited to hear Bob and Senator Brown continue that conversation when we get into the discussion portion of the call. Hello, everyone, and welcome to a virtual roundtable about this critical need for paid family and medical leave for all working people. In this pandemic that we're all experiencing, the need for paid family and medical leave has never been more clear. Let me introduce myself. I'm Katie Bethel, and I'm the founder and executive director of Paid Leave for the U.S. We are the national campaign to win federal paid leave policy, that's policy for everyone, by 2022. And we're thrilled to be partnering with Senator Sherrod Brown and the Ohio Women's Public Policy Network to bring you this critical conversation. I'm going to share just a few remarks to give you some national context about what's happening with paid leave today and why it's so important. And then I'll introduce you to the senator who's going to lead us in this conversation. Even before this pandemic, 114 million people in America didn't have access to a single day of paid leave. Families had to choose between taking care of a loved one who was seriously ill and going to work, even in life and death situations. The pandemic is making this problem that already existed more visible and worse. I've used paid family and medical leave a few times in my life. There was when my husband and I dropped everything to go and spend time with my father-in-law for his last 3 weeks of life. There was the time I welcomed my daughter into the world and took the time to have my body recover from a difficult birth and to establish breastfeeding and bonding with my daughter. And there was the time where paid leave made it easy for me to be the one in my family who went and sat at my brother's bedside when he was hospitalized unexpectedly. In our country, women and people of color and children disproportionately bear the cost and responsibility of supporting families. Today, the people with the highest incomes are 3.5 times more likely to have paid time off than those in the lowest income brackets. So this economic inequality most deeply affects people of color. Black and Hispanic people are far more likely to be in low-wage jobs, and so it disproportionately affects these communities as well. And the pandemic has only exacerbated this impact. 1 in 3 Black women in the US is working on the front lines of the pandemic. In a recent poll of working people, over half said that they're less likely to get tested for COVID because if they got a positive result, they couldn't afford to miss work anyway. So passing paid leave legislation is a critical step toward ensuring the health and economic stability of families in America today, in the pandemic and beyond. We do have one small bit of help in the Families First Coronavirus Relief Act. That gives some people some extra paid leave if they have increased childcare needs or need to recover from COVID. But that left out employers with more than 500 employees, like Amazon and Walmart. Employees at Amazon and Walmart can't access the Families First Coronavirus Response Act paid leave. So we have a long way to go to even get to the coverage we need in this pandemic. We also are going to hear from business owners today about why paid leave is an important policy for them. Today, 3 out of 4 Americans say that they would be more likely to shop and eat at businesses if they knew the employees had access to paid leave. And small business owners in states that have paid leave programs report overwhelmingly that the policy has helped their businesses and allowed them to compete for great employees on a more level playing field with big corporations. So as we participate in this moment of a growing cry to address racial inequality in this country, to address the health crisis of COVID-19, and to put our country on the path to economic recovery, we need to make sure it benefits everyone, not just the uber rich, and paid leave is an essential piece of this puzzle. Today, you're going to hear from brilliant, inspiring leaders in the community about why paid leave is so important. And you're going to hear from one of my favorite US senators, Senator Sherrod Brown. Senator Brown has spent his career fighting for the dignity of work, and I love that word, dignity. It's the idea that hard work should pay off for everyone, no matter who you are, where you live, or what kind of work you do. He's held nearly 500 roundtables just like this around Ohio because he believes that the best ideas don't come out of Washington, they come from conversations with Ohioans. He lives in Cleveland, Ohio with his wife, author and Pulitzer Prize-winning columnist Connie Schultz, and their rescue dogs, Franklin and Walter. And they have 3 daughters, a son, a daughter-in-law, 3 sons-in-law, and 7 grandchildren. We might get to see one of them today. And I'd like to welcome you now, Senator Brown. Thank you so much for joining us.
Katie, thank you. Thanks for your generosity, and thanks to the Ohio Women's Public Policy Network for the work that you all do. And Katie, your leadership with paid leave for the U.S. is so important. And the pandemic, people say this pandemic has been the great revealer. It has told us so much about this country, about this country's racial disparities, about wealth inequality, about the holes in our safety net, about the challenges we face because we're fundamentally the only rich country in the world that doesn't provide the kind of family benefits that our country should. And what you are doing with paid leave for the U.S. is so important. Council member and Executive Director Liz Brown thanks one of the leaders in our state pushing for paid family leave and paid sick days. Thanks to our 5 panelists. I've gotten to talk earlier with several of them, and thanks all of you who have joined and listened to this roundtable discussion. I appreciate the work that you've all done. Tens of thousands of Ohio workers, including many of the workers we're now called essential, have no paid sick leave or paid family leave at all. One grocery store worker in Southwest Ohio told me, they tell me I'm essential, but I feel expendable. They don't pay me very well. They don't protect me at work, and I have no help at home with my children. President Trump wants to go back to the same business as usual, forcing people back to work with no protections, with the same low wages. I met a woman in New Hampshire about a year, maybe almost 2 years ago, and She's devoted her life to childcare work and childcare advocacy. And she said childcare should be a public good, the way that we consider parks, the way that we consider public education. It should be part of our public structure, if you will. Raising a family should be a public good. Childcare is an important part of that. So is paid leave. When people can't take the time they need to care for family members or to keep themselves and their families healthy, we have a broken system. And what Katie said about upper income people contrasted with everybody else when it comes to childcare just grows the wealth inequality and those racial disparities. We know essential workers are more women than men in this society. We know essential workers are disproportionately people of color, and we know essential workers are paid less than most. When we know that child care issues, we know the child care issues this pandemic is causing. I heard from one Ohio grandparent, Amy, who said to me, I was forced by my company to take an unpaid leave. Workers shouldn't have to choose between staying home to take care of their health or their family and getting a paycheck. Many of us worked hard to make sure one of the bills we passed this spring included some provisions on paid sick days and paid family and medical leave. But as Katie pointed out, these provisions didn't go nearly far enough. They expire at the end of the year, just like unemployment expired at the beginning of last month. I guess we're in September now. Millions of Americans still don't have any kind of paid leave benefits. I know some of you work with companies that do right by their workers. I just spoke to Bob about what he and his family have done. Companies shouldn't be forced to compete with huge corporations that refuse to provide benefits. And Ohio workers shouldn't be at the mercy of the company they work for. That's why we need a permanent solution for all workers. I'm co-sponsoring a bill with Senator Murray of Washington State, the Paid Leave Act, that Katie's been involved with to establish permanent requirements for paid sick leave and paid family and medical leave. If Democrats take control of the Senate, and if Joe Biden beats Donald Trump, I'll become part of a key subcommittee that handles paid leave on the powerful Senate Finance Committee. We will work with the administration to do this. When progressives win, we do big things that have long-lasting impact. This will be one of them. There's no dignity in a job where you're forced to choose between you and your family's health and a paycheck. It seems obvious to everybody in this call because you're leaders in your community and around the country on this. But we know the corporate crowd and its allies in Congress have fought to stop paid leave for decades. We're up against corporations whose entire business model is built around exploiting workers, keeping wages down, busting unions or keeping unions out, particularly Black and brown workers and women. We've seen that same attitude on display right now. The stock market's back up, so Trump and Senate Leader McConnell seem to think everything is fine. Well, it isn't. It wasn't fine before the pandemic. It's worse now. We need to do better than just go back to what it was. I know you all feel the urgency. One of my favorite Dr. King lines is Dr. King said in his letter from the Birmingham jail in 1963, he said that progress never rolls in on the wheels of inevitability. Progress never rolls in on the wheels of inevitability. It rolls in, those are his words, by dressing it up, not as well as it rolls in because we make it roll in, and you are some of the best activists in Ohio. I'll stop there and I'll turn it over to Councilmember Brown. I look forward to our conversation. Liz, good to see you.
Thank you. Thank you so much. I am Elizabeth Brown. I'm the Executive Director of the Ohio Women's Public Policy Network. We are a coalition of nearly 40 women's organizations, partners who come together across Ohio to fight for policy solutions that build economic opportunity for Ohio's women and families. And at WPPN, access to paid family and medical leave and paid sick days is an integral part of our policy platform, because these policies are truly critical for helping working women stay healthy, care for their loved ones, and provide for their family, particularly during the pandemic. As both Katie and Senator Brown noted, the pandemic is hitting families differently, depending on their income level, depending on their skin color. And we know that equitable policies like paid family leave are critical to helping families recover, particularly Black families and Latinx families who've been hit hardest, first and worst, by the unemployment of the COVID-19 downturn. We also know gender equal paid family leave policies mean that women don't have to shoulder caregiving burdens alone. We are so pleased to partner with PL+US and Senator Brown to bring you today's critical conversation about the importance of paid leave, both during this crisis and for the long haul. I get to welcome our panelists today because, and we're really excited to have them here because these are the voices that matter most. We're highlighting advocates and business leaders from across the state who will be sharing their stories and perspectives on the importance of paid leave because we know their stories, because all of us knowing their stories means knowing the transformational power of paid family leave to help our families, our communities, and indeed our whole economy. We are joined today by Morgan Lyles in Columbus, who is a caregiver, a mother, and a PL+US advocate. Dora Anim, based in Cincinnati, who is the Chief Operating Officer for the Greater Cincinnati Foundation, which is a certified employer with Queen City Certified. Jon Gromek in Lakewood, who is a caregiver, father, and PL+US advocate. LaTeeya McGhee in Columbus, who is a caregiver, mother, 0 to 3 Strolling Thunder advocate, and a community health worker with the Moms to Be program at The Ohio State University. And Bob Szuter in Columbus, who is the co-owner of Wolf's Ridge Brewing. So thank you all for joining us for today's roundtable. And with that, let's kick off our discussion. To start, Morgan, can you share more about your experience navigating the need for parental and caregiving leave at the same time and what paid leave means for you and your family?
Sure. Thank you, Senator, for being with us today. I think paid leave kind of became so important to us. In December of 2018, I was pregnant with our girls, but my husband has a seizure disorder. So he was hospitalized and on a ventilator and in the ICU for a period of time. But because I had to really, knowing that I was due with our girls later that spring, preserve my sick and vacation leave to supplement the parental leave, I wasn't really able to be with him in the hospital the extent that I would have hoped to be. Not to mention, like, when you're pregnant, somebody being on a ventilator, that's a stressful scenario alone. But knowing the state only grants, the state does provide paid leave to full-time employees, but it is at a reduced rate of pay, and it certainly wouldn't have even covered the NICU stay for our girls. Our girls were born at 30 weeks, so they were in the NICU for 6 and 7 weeks. So we were really kind of balancing both of those, knowing that I only had a limited amount of sick and vacation time. At the end of the day, I'm fortunate. We did have paid leave. I only had a limited amount that was unpaid, and our family can withstand that, but many can't. But after maternity leave, I went back to work with all 0 leave balances and still had NICU follow-up for the premature twins and my husband's medical care, which is ongoing to this day. So I think it's, for us, really kind of heightened, there are so many families that don't have the benefit of paid leave, and how important that is when you're trying to balance those stressful things. And getting sick or having a chronic health condition shouldn't be mutually exclusive with starting a family. If you have to exhaust that leave for one or the other of those things, then you're not in a good position to handle the other. Senator, I think you were right on when you said really that paid leave that the pandemic has been such a revealer. We are fortunate in that we've both been able to telework exclusively since the start of the pandemic. But in doing so, my husband's only been hospitalized once since April, which is, that's far less than is typical. I wouldn't say that that's the cause of it, but I do think that it helps that I'm here and can intervene when he's having seizures. I could administer rescue meds. I can track them and know how many he's had and at what point I need to make other decisions. So that, I think, is, it's really shown that the importance of having a caregiver, especially for a condition like that truly requires somebody to be able to provide physical intervention, and from a diagnostic perspective, anytime we have a doctor's appointment with him, it's more of a conversation with me. He can't report to his neurologist what happened before the seizure, what happened during, what happened after. He typically doesn't have any recollection of them. So for me to be able to tell the doctor it lasted this long, this is what his body was doing, this is how he was after, those diagnostic tools are helpful with our neurologist and, you know, charting a course of treatment, a course of action for him. So I think when we talk about the caregiver piece of it, there are certain conditions that, you know, he can't drive. It's important to have somebody available that can fill that role, and to not have to worry about losing compensation makes that a lot more doable. I think, especially too, when we're talking about the piece of it with respect to having children kind of at the same point in our lives, we literally this year, as soon as my FMLA entitlement reset when our girls were a year old, then filed FMLA paperwork with my employer to say, hey, she may need leave intermittently for his condition. So, you know, when we're so limited even on FMLA, if you have to rely on FMLA or sick leave or vacation leave to have a child, then you truly don't have anything left to handle a chronic condition or, you know, God forbid, an accident. I had a friend that was hit by a car after having a baby. You know, when we don't have adequate leave, Americans are just left without any recourse to take care of themselves and their families in those situations.
Thank you for sharing that, Morgan. And I think that you really hit the nail on the head in terms of that stress in your sort of the caregiving side. I don't imagine it's very easy to be at your best at work when you're not given that flexibility to take care of the people that you love most in the world. And that's why the employer side of this conversation is a really critical piece that I'm grateful to PLUS for highlighting. And I'm really grateful to have Dora here today to talk about your position, Dora, as an employer. The Greater Cincinnati Foundation understands exactly what Morgan hit on, what I just said, this important role that benefits like paid family leave can play in attracting talent, and then supporting your employees to be their very best and to serve the employer at their best. Yes. Can you share a little bit more about GCF's experience with paid family leave from the employer side?
Yes. Thanks, Liz, and thank you, Senator Brown, PLUS, and everyone for the opportunity to be here and to talk about this really important topic. So my name is Dora, and I'm really here to represent two voices. I think Liz is correct. I want to represent the voice of the employer. As the COO for Greater Cincinnati Foundation, you know, we are the largest community foundation in Greater Cincinnati. And we have a big vision, big mission to build a community where everyone can thrive. That's really important to us. And to achieve this big mission, we realize as an employer that we have to have top talent. When we say top talent, we're looking for the smartest candidates that don't just get the job done, but can do it better, smarter, and more efficiently, because our community depends on us in order to build this community where everyone can thrive. So we have set a goal as an employer to be an employer of choice for our region. And that commitment involved becoming Queen City certified. So if you're not familiar with Queen City certified, it's the first employer certification for gender equity in the US. And we wanted to design a workplace that works for everyone, regardless of race, gender, and sexual identity. And that involved looking at our paid family leave. If we were gonna promote ourselves as an employer of choice and a great place to work, for us, it needed to be true in practice as well. So we looked internally and engaged a group of cross-functional employees, our own employees, to design a paid leave policy that works for us, for our employees. This process took about a few weeks, and this internal committee came together, did some research, and discussed what best guidelines would work for our organization. This co-designed policy will be going to our board for approval later this year. So we know for a fact as an employer that when employees and their families are supported, they perform their best. When employees know their families are taken care of, when they are at peace, they bring their best to work and they are high performers. That's a critical, important point for us as an employer. And we have also found that most employees don't end up needing to use all these benefits. They just find comfort in knowing that they're available. And this impacts morale, culture, and productivity. So for us as an employer, it's a win-win situation. The second voice I wanted to represent is the community that we serve. So the low-wage workers in our region, as I mentioned, we are focused on building a community where everyone can thrive. And for us, that means focusing on our most vulnerable and low-wage workers. Low-wage workers are the least likely to have paid leave, as has been mentioned this morning. And our Women's Fund that is within Greater Cincinnati Foundation has spent over 8 years researching the challenges of low-wage workers. So we have a deep understanding of these needs. We know that they are disproportionately women and people of color. And we know that one life event, caring for a loved one, can be extremely disruptive and destabilizing. We know that only about 30% of low-wage workers have access to paid leave. And without paid leave, you're constantly forced to choose between giving up a critical paycheck, going to work, and potentially spreading the disease that you're ill with. And these issues are going to continue to grow because the number of low-wage jobs are increasing. Most of the common jobs in our region do not pay a living wage currently. So policies supporting workers and their families, like paid family leave, is good business as well. We often hear employers cite high turnover and low employee engagement as two major workforce challenges. Let's explore that. When you have a mother that is bearing the greatest responsibility for childcare and is the primary caregiver, that has a sick child or a school that is closed, due to a public health emergency, for instance, women often forego work to care for their children. This is a major factor that leads to high turnover and low employee engagement. These are the very same things that our employers are citing as concerning and challenging. If we fail to address paid leave for our low-wage workers, we will continue the cycle of turnover and instability for many employers that experience today. Families should not have to choose between taking care of their families and putting food on the table. We need to prioritize their needs. These are our essential workers, both in the face of the current health crisis, but also in the future, recognizing that this is something that affects all of us. We all want what is best for our families, and that is no different for low-wage workers. And providing family leave is not only humane, but in the long run, it's also smart business.
Thank you, Dora. Both of those voices are powerful and important to the conversation. I really appreciate you highlighting the local perspective from Cincinnati in terms of the community that you serve. And I have to say, I think you could tell that story about that exact story while your expertise is in Cincinnati about communities and cities across our state and surely across the nation. So thank you.
Totally.
Thank you, Dora.
Thank you.
I want to bring Jon into the conversation. Jon, you've had two very different leave experiences between your two kids. So narrowing back in on the personal kind of firsthand importance of making sure that fathers have access to and utilize. I think it's on all of us to help normalize fathers' uptake of paid parental leave, So how has paid leave, Jon, made a difference in your life for your family? What does it mean to you now during the pandemic as you take on caregiving responsibilities too?
Sure. Of course, thank you both, Senator Brown, Councilwoman Brown, and everyone here for your leadership. It's so important right now. I'll start off by saying in many ways, my story is both not extraordinary at all, but also extraordinary. Not extraordinary at all in the sense that far too many families have to endure this across Ohio and across our country, but yet it's still extremely frustrating to navigate a world with your family without paid leave. I guess I'll start honestly with my experience not having paid leave first. Actually, Morgan and I have a very similar story from the start. This was about 2 years ago. We were pregnant with our second child in the fall and found out that I was going to be let go while my wife was pregnant in a high-risk pregnancy. So as scary as that was, as I struggled and hustled to find work, not just have a paycheck, but health insurance during a time when it was extraordinarily needed for my wife and our child, luckily did. A couple of months later, found full-time employment, which I was extremely grateful for. Unfortunately, that employment came with no paid family leave, but also actually no paid time off in the first 90 days of my employment, which was square in the middle of when we were going to be due with our second baby. So I remember in February when our son was born, I was granted one special day off to be present at his delivery. He was born on a Friday. We stayed in the hospital till Sunday, and Monday I went back to work. And, you know, I was very blessed to have supportive colleagues who were trying to make things work. I got to work from home for a couple of weeks, but anyone with a newborn child and kids at home knows that those first 2 weeks, even if you get to be home, still working is not leave. And shortly thereafter, actually, our son actually got sick. He wasn't eating. He was losing weight drastically. So even when I did get that PTO finally kicked in, it was just a blur of doctor's visits, meetings with specialists. Our son had to eat every 3 hours. In fact, he couldn't cry for prolonged periods because that would burn precious calories. So literally for 6 months, my wife and I took 3-hour shifts from 7 p.m. to 7 a.m. Because he would only sleep on us. So I got a lot of work done on my phone during that time, but yeah, just an extremely stressful time for our family, and to know that it didn't have to be that way. As Liz mentioned, I was really lucky enough with our first child to have a night and day experience. Both my wife and I had employers provided paid leave, and my wife's a teacher, so she actually had the summers off. And we were able to cobble together 9 months of paid leave between the two of us, where there was always one parent at home. And it was just a transformational experience just to be able to be present, especially with our firstborn, as we were really figuring things out as new parents, was life-changing. Just to have those memories and experience, not be stressed when one of us was at work, to always know that the other was there, that we didn't have to worry, was the biggest blessing I think I've ever had as a parent. But, you know, as you said, Liz, it's night and day. And unfortunately, there's too many families that have too much of the night, the darkness, not so much of the day and the light. And, you know, now I think, especially during COVID, I know so many families are struggling as well, just with the uncertainty. As I mentioned, my wife's an educator. We have a lot of teachers in our family. Usually the start of school is a really exciting time. But there's a lot of anxiety right now with COVID, and just knowing if something happened, if someone got sick, what we would do. Or actually, our son's 5 years old. He was slated to start kindergarten at a Montessori school. The school actually shut down because within 2 weeks, they lost half their enrollment because parents were just so unsure about what would happen, you know, if someone got sick, who would be there to get care of. So we actually had to switch schools last minute, but, you know, it's very real now as well.
Thank you, John. That story about the Montessori, your Montessori school also is, and that's not even a factor that I considered, but it shows how interconnected these policies are to supporting the whole economy, to supporting communities. So thank you. Thank you for your story.
Thank you.
LaTeeya, I'm really happy to be talking to you and to bring your story into the conversation. I know that through the birth and early years of your daughter, you had a high-risk pregnancy and did not have access to paid leave. That led to financial obstacles that you and your family had to overcome. So can you share more about your experience and maybe about how paid leave would have actually made a difference for your family and why it's crucial for those in the future as well?
Well, in the beginning of my pregnancy, we started off as a 2-income household. Neither one of us had paid leave. He made whatever decisions he wanted to make, my ex-husband, and decided not to be a part of our family. So I was just stuck with my income, and with my high-risk pregnancy, working in a factory and having to be at the doctor every week, it was not realistic. So I was forced to quit my job, and then and still back and forth to the doctor at the end of my pregnancy, and then moved in a shelter. I had to move into a shelter. They had to help me financially with housing. I still wasn't working and had income. So all that was a struggle, which led to an eviction process. I was trying to go back to work, but I had a C-section. She was 11 pounds, 7.4 ounces at birth. So my recovery wasn't as speedy as I would like it to be to rush back to work. So I struggled trying to be home and still had my other daughter who was 7 at the time, and still trying to maintain her back and forth to school, and also a new baby too. Later on, we found out that she was diagnosed with seizure epilepsy. So that was another issue coming up. And it's just me and my 2 girls. We don't have, well, my ex-husband, I ended up getting divorced after the birth. So it's just always just been me.
Thank you for sharing that. And the stress of the high-risk pregnancy alone is huge, no matter the other factors. I know that you are also an advocate with the Moms to Be program here in Columbus. And so you meet a lot of other mothers who probably have situations somewhat similar to yours. And if you have anything, anything you could share from that perspective, I'd be curious sort of what you're seeing from those mothers who are in this community health program. It's probably not common that you meet a mother who has access to paid family leave in the Moms to Be program. Am I right in that assumption? Oh, LaTeeya, I think it might have, the screen might have frozen. Oh, now you're muted. Oh, we still can't hear you. You're on mute.
I see that our barriers in our community with our moms are increased because of this. Some moms are lucky to have employers who will not cover 100, but I had a mom who was like 80%. I said, that's better than nothing. And she was able to breastfeed and do things she needed to do, because when you're one of those parents that have to go right back to work, you don't almost have breastfeeding as an option, because you have to have that option to pump in between shifts and things like that. So yeah. I just feel like once one barrier is hit, then there's more that's back to back in our communities.
Yep, that's exactly right. Babies are healthier when their parents can take this time with them. Thank you for highlighting that. All right, so Bob, I'd love to, I'm really excited about your voice in this conversation. As a restaurant owner, it's very clear right now in this economy, the service and restaurant industry have been hit especially hard by the coronavirus pandemic. So how has paid leave played a role in Wolf Ridge Brewing's ability to navigate the crisis? I know that your policy has been in place for quite some time. You were there actually with WPPN as we helped roll out the first Ohio introduction of a state paid family leave program introduced bill, which has not made it to a full vote yet because of Republican control in the legislature. But you were there from that point, which was years ago now. Can you talk about how that has affected your ability to navigate the crisis, and then also what paid leave generally means to you as a business owner?
Yeah, absolutely. Thank you, obviously, for all the work you've done, Councilwoman, and a more personal note on the support in Columbus that you've done on the council there as a resident and a business owner in Columbus. I appreciate it. Thank you, Senator, for taking the time. Yeah, paid leave for us, kind of started out a little about a year after we had opened up. My wife had given birth to our daughter. She was 14 weeks early. And, we were both, even as privileged as we are, we're both surprised that she had to start the paid leave, the time of birth rather than, after she got out of the NICU or sometime later. And then, digging into it, understanding more about how paid leave worked. That was a little bit of a shock, but it didn't take us long to kind of connect the dots and say that, our staff are in an even worse position and we should do something about this. So we had 2 instances early on where one employee had to kind of work in advance and save up money to have a planned surgery and have time off, but obviously was getting back to work as quickly as she could. And then another employee who broke his leg and obviously could not work. So, we started out with the short-term disability policy, which obviously would take care of some of that. But, again, as LaTeeya mentioned, like that doesn't cover 100%. And, it's certainly not, it's not an end all be all. So we kind of went further and tried to see what else we could do. So we started a paid time off policy for all staff, and giving everybody a week per year of paid time to start, and we're working to add to that. That's been extremely beneficial for staff. Before the pandemic, we had two fathers take advantage of it. We gave them 2 weeks. We had one of our servers whose father passed away. She was able to take some time. And these are all these different situations that are just so basic to humanity that, you kind of wonder how they're not understood by most people. And, so my dad and I, when we started this, we wanted to take a different approach, I think a more humane approach to work, and make sure that, our staff felt secure and safe in their jobs. That approach and these policies that we put in place have, helped us be better positioned now. That's absolutely true. As Dora mentioned, employee engagement and employee turnover is, a huge kind of selling point for people to focus on with what's, not going right sometimes in their businesses. And, for us, the engagement that we've had from staff and the employee turnover that we haven't had is directly related to, these policies and our approach. In 2019, we had 33% turnover versus the industry average, which is about 50%. 70% of our staff have been with us for a year or more, and this is the restaurant business. This is not a low turnover, low, or high employee engagement place. So we, all the policies that we've put into place have absolutely been helpful for this. And, again, for us, as we've kind of put a hodgepodge of policies together, there's still, glaring issues that I think need to be addressed. And, that all kind of comes down to creating a level playing field of some policies that all of us can take advantage of. And, we have directly seen the benefit of doing that. And, people aren't taking advantage of this. Sometimes that's an argument that I think, some people like to make, that they're just going to sit at home and take time off. The short-term disability policy is the most expensive component of this, and it's the least used. Obviously, it's very restrictive in terms of how you can use it. The paid time off policy, which is, whatever they want, has amounted to less than 0.5% of our total compensation since we started this policy. So it does not cost money. And it absolutely gives people safety and security, knowing that they at least have something should something come up. And it just reinforces the approach that they're taking care of. And, with all of the things that we are all, dealing with on a daily basis, this is just one that they don't have to worry about. And, it means something to them. And I think it's extremely important. So.
Thank you, Bob. Those numbers for employee retention are impressive. And just as you pointed out, only especially so in the service industry and the restaurant sector. And I know that training costs are such a big part of employee turnover. So hearing your story, it's really important for all of us to remember, not only are you saying that it doesn't cost a lot, it also means you're saving costs on retraining and the hiring process and being short while you hire new people. So thank you for that perspective from an industry that I think doesn't have a high percentage of paid leave available to employees.
Welcome.
Okay, well, I want to open things up actually for Senator. I know that you're a big question asker, and you usually have questions for folks. So can you unmute yourself and whatever you got, please go for it.
No, I want to just keep listening, really. I was taken by the stories of Mr. Gromek and Ms. Lyles and Ms. McGhee. Just the struggles that when thing goes wrong. I mean, one of the things we know during this pandemic is that particularly with unemployment benefits expiring and with the moratorium on evictions expiring at the same time that around the country, moratoria on water and electric shut-off have expired too. And what happens to families when one thing goes wrong, and when if a quarter of renters in this country, prior to the pandemic, a quarter of renters pay more than half their income in rent. One thing goes wrong in their lives, they don't have sick pay, and most people that are in that income category that are at low income don't have this, as you've all pointed out. One thing goes wrong in their lives and everything's turned upside down. And I could just see the struggles of the three of you, especially as you talked about an illness or something that happened with a family, how hard that is. I was really taken with Bob's statement about basic to humanity, and that's a really good way to look at this. As that woman in New Hampshire said to me, that it should be public policy. However she said it, I forget exactly how she said it. That it should be a public good. That family leave and sick policy and childcare should be a public good. So I really wanted to just keep listening to people's stories. I was really taken. I mean, when I hear these stories, I just think if every state legislator would sit here and hear these stories, if every one of my colleagues in the House and Senate in both parties would hear these stories, we'd have a very different way of legislating and looking at the world. That's so keep singing these stories out, keep telling them, keep finding platforms like this to talk about them. So
Great. Well,
back to you.
Thank you. Thanks. We've got some questions coming in, and actually a few of them are for you, Senator, instead of the panelists. So we've got a couple sort of about
how weird it is for your daughter to call you by a title. I mean, it's just kind of weird, but anyway, go ahead.
I'm just trying to be formal. We've got a couple sort of legislative questions, and I'm going to start with one that's pretty timely considering the coronavirus. And I know that you've been working on trying to get another coronavirus package passed. So this person is asking, regardless of the outcome of the election, do you see the Families First Coronavirus Response Act paid sick leave and emergency paid FMLA benefits extended into 2021? So basically the benefits that were passed in FCRA, do you see those being extended into 2021?
Yeah, I think the answer is yes. It obviously depends on who wins this election, and if Biden wins and the Democrats win the Senate, these are very high priorities. I mean, there's one of the first thing we may do. I think the first thing we'll do if the elections come out that way is we'll pass the John Lewis Voting Rights Act to restore some of the civil rights in voting that the Supreme Court 4 or 5 years ago took away. I think we will move on minimum wage. I think we'll move on the overtime rule. I think we'll move on family leave policies, of the kinds of things that pretty much all Democrats in the Senate and the House stand for. Pelosi has passed many of these in the House. I expect we'll move on. They think we'll do more than just extend this. I think it will expand it more along the lines of the bill I mentioned that Katie's worked on with Patty Murray. I would assume we will. Everybody has their. Every senator has their 2 or 3 or 4 top priorities. One of mine is housing overall. That we have a terrible housing shortage for moderate income people in this country. And it's caused such huge hardship on those families, affordable, accessible, safe housing. And I think that's going to be a long-term outcome of all of this. It needs to be.
Mm-hmm. Interestingly, I mean, just since we're talking about family issues and housing is one of those, we've seen the connection between pregnancy, keeping sort of lower risk, keeping pregnant women healthier, and keeping housing stable. That housing instability actually is has a higher correlation with preterm birth and high-risk pregnancy than even smoking does. Thank you for highlighting that about your housing work. It's part of it.
In Dora's community, there's a high school, Euler High School in Lower Price Hill that Dora, I'm sure, knows about. And for a year, this was a mostly Appalachian white student body with terribly high dropout rates, low performing school. Students were not very, most of them came from families that were very low income. And the Cincinnati public school system sort of widened its enrollment area. So it's now about a 50% white, 50% of color, students of color in the school. They have done all these wraparound services to make it a community school. And again, one of the poorest areas of Cincinnati, both white and black. And they've, the graduation rate's way up. They provide all these kinds of services, understanding that as the pandemic has been the great revealer, as several of us mentioned, that everything from low birth weight babies to, the racial disparities are certainly in health, in kind of the low birth weight babies, and for mortality, maternal mortality, life expectancy. They're in the justice system, no question. They're in the public education system where low income kids, the disparity grows during this pandemic. Between low-income kids and upper-income kids, and it's in housing, and all these things are so interrelated. A community school answers a lot of that, but so does a lot of the work that you're doing with Women's Policy Network, Liz, and so many of you are doing with the group that you're involved in, Ms. McGhee and others. So that it really is going to take a much more comprehensive look at this, not just providing family leave, not just providing sick days, not just investing in public education, not just investing in housing. It's really all the above.
Mm-hmm. I'm going to pull in a question from the chat that it might be good for you to hear before you have to go, Senator, about the employer side. We have someone in the chat who is a small business owner. So Dora or Bob, please chime in on this one. Catherine is saying that she agrees that paid leave is needed, and that she should provide it as a company, but as a small business owner, her business is white collar. She fears the huge added expense, feels that for large companies that are currently paying, and her characterization, little to no taxes, that this is an easy task. So she's wondering, as a small business owner, basically how this can work. So I want to highlight, and I want to allow you guys to answer those questions, but I want to highlight that there are different versions of the bill, and ultimately being able to offer paid family leave privately as an employer yourself is something that has a real high cost to entry for many, many companies who can't, figure out a way to make it work and still stay in the black, and that a large solution, a national equal solution, actually makes it workable for most companies, most people at a broader scale. That's the philosophy behind a federal plan. But Bob, do you have anything to add to this as a small business owner?
Yeah, absolutely. As I mentioned, I think the short-term disability policy that we have in place is definitely the most expensive component of what we offer. And I absolutely believe that would not be near as expensive if we could spread this out along, among a greater group of people. Look in Ohio at the Bureau of Workers' Compensation and how much they're able to keep costs down, how much they're able to give back to employers as kind of an example of this shared responsibility. The paid time off policy that, I think something that any company should start very basic and just allow for folks to take off time that has been, extremely insignificant in, as a cost of our business. And we have 55 FTEs, so we're not a huge business. We're not, 10 or 20. I can understand it's a little bit difficult, as you get down there, but I think a general policy that is provided by the state or federal level is going to be, more beneficial for everybody. And yeah.
Thank you. Senator, were you leaning in for a follow-up on that, or?
No, I thought that it's pretty interesting what he said about the 0.5% earlier in your comment. You said 0.5% additional cost, and I think that's your point, Elizabeth, about making it a national program. The things that the federal government has done, the big social insurance programs of Medicare and Social Security, were national. They are a cost to employers. We need to recognize that. We also recognize that because the cost is because of the uniformity, it doesn't necessarily it doesn't put some at a disadvantage or an advantage over others if done right. When we did that very compromised CARES Act on what we did with employer costs, and we exempted companies over 500, that was just absurd, because those are the ones that should be doing it and can be doing it. But they, no offense, but they have better lobbyists in Washington than Bob has. So,
Yeah.
If I could just add, one thing. I mean, these are things that are happening to every human. This is not something that is happening in one sector of the economy or one business. So if we just, understand that, then let's get back to focusing on the things that are important to our business, and I would much rather spend my time and effort and resources on providing, different benefits or something that can improve our competitive advantage in the market than something that is, that every one of us has to deal with at some point in our life.
Mm-hmm. Yeah, and I will add that the cost outweighs the value and the benefit longer term, especially when we know that most employees don't end up taking advantage of the benefits. Just the knowledge of knowing that they're there improves morale and productivity and goes a long way. So at least having something in place, even if it's a bare minimum, really has greater value.
And I like what several of you said about how your employees knowing that they have these benefits, whether they use them or not, just makes us all better in the workplace. You don't have to sit there worrying about your child or worrying about your spouse and not being able to get the care she needs or he needs. So
provides a sense of security.
Yes. Well, thank you. I want to wrap up there, and I like Bob's comment. These are things that happen to every human. Just remember, we highlighted stories on this call today, but these stories are out there among everyone you know. This happens to every human. I like that really basic way of saying it, Bob. And so I want to thank you, Senator, for being here with us. We didn't get to all the questions in the chat, so I will highlight two things that also came up just for you to take back with you to Washington. There are folks here, both Lars and Jonathan highlighted the need for equitable access to paid family leave, including higher wage replacement, strong job protections, and an inclusive family definition. And then also the need to consider during this crisis that many people with compromised health conditions are having to choose between their health or their paycheck because of, if they're vulnerable to COVID, they're not protected. And so those are two things for you to take back with you. It's 10:59. I've already gone over my time. So I am going to hand things back over to Katie.
Thank you so much, everyone. Thank you to Senator Brown's team, and Trudy and Sarah, to Elizabeth and Aaron with the Ohio Women's Public Policy Network, our panelists, Morgan, Dora, Jon, LaTeeya, and Bob, for sharing your powerful stories. Everybody check out Wolfridge Brewing and the Greater Cincinnati Foundation. And thank you to our partners in this 0 to 3. You can join this fight. Watch your inbox for how you can get involved with PLUS in order to fight for paid family and medical leave for everyone in the U.S. We have our next advocate organizing call on September 15th. Mark your calendars, come in. The powerful stories that you heard today, as Liz said, everybody has a story. And your experience is what will help legislators understand why it's so important that we finally pass paid family leave for everyone in the U.S. Thank you so much, everyone. Have a wonderful day.
Thank you. Thank you to Erin Ryan, too, for your work on this, since I didn't get to see her picture on there. Thanks, everybody. Good work. Thanks, folks.
Yeah.